An ambulance is often the quickest way to transport an injured patient to the hospital for treatment.
They said overall edema.
Once inside a trauma center, that treatment is critical to their overall survival. Researchers in Washington state found patients who die from their injuries while in the hospital decreased from 8% in 1995 to about 5% in 2008.
That's a good news. So many more patients survive the hospital stay and get discharged.
Dr. Sam Arbabi from Harborview Medical Center in Seattle and co-authors then wanted to know where these patients go after leaving the hospital and what are their long-term survival rates. Researchers analyzed statewide trauma records which were linked to death certificate data over a period of 14 years.
Overall, trauma patients have a higher likelihood to die even if they survive their injury in the hospital compared to non-trauma patients.
The study appears in this week's JAMA, Journal of the American Medical Association.
We expect the mortality rate to be somewhere around 9 to 10%. Their mortality is actually up to 16%. We also found out that patients being discharged to different places have different risk of death.
After hospitalization for trauma, about half the patients go home. The rest are admitted to rehabilitation or skilled nursing facilities.
Patients that get discharged to skilled nursing facilities as opposed to patients that get discharged to rehab centers or patients that get discharged home have higher risk of death in 1 year and 3 years.
Researchers do emphasize that patients released to skilled nursing facilities are often older and lower functioning than those who go elsewhere.
It doesn't suggest that skilled nursing facility is the cause. It's an association, but it does suggest that there is an area that we can improve outcomes.
Catherine Dolf, the JAMA Report.